Good morning. Can you hear me well? Yes. Good morning. My name is Frankie Miranda. I am the president and CEO of Hispanic Federation, and it's my great pleasure to welcome you to this roundtable discussion on mental health in the Hispanic community. Thank you to Secretary Becerra for making it all the way here to the Bronx and the entire team for convening this important discussion. Access to mental health services for the Latino community is a top priority for the Hispanic Federation and our member agencies, especially our host today, Comunilife, and other organization member agencies like Acacia Network present here. New York families, especially those from underserved backgrounds, are experiencing devastating challenges to the direct and indirect effects of COVID-19. Even the Centers for Disease Control and Prevention has recognized that the disproportionate impact of the COVID-19 pandemic on communities of color have resulted in greater reports of depression, anxiety, and stress. Disparities in access to treatment puts the Latino community at a higher risk for more severe and persistent forms of mental health conditions. But we need solutions that will focus on our community needs, the rich diversity and the intersectionality of our community. As the first queer president of the Hispanic Federation, it is my personal commitment to further support our member network, providing solutions by community like Life is Precious program are so vital. Their work changes and saves lives across New York. Comunilife have provided cultural and linguistically relevant services to more than 4,000 vulnerable New Yorkers. That's amazing work, and that is why we're here at this location today to have this important discussion. Thank you again to Secretary Becerra, Deputy Secretary Palm, and Assistant Secretary Delphine Rittman for joining us today. Before we turn it over for remarks from the Secretary, we are going to do a quick introduction for our panelists, and let's start with Dr. Rosa Hill. Get us started.
Good afternoon. I'm Rosa Hill. I'm the president and CEO of Comunilife Inc.
Okay, go ahead.
Roberto Luis Fernandez. I'm a professor of clinical psychiatry at Columbia and the director of a cultural competence research center at New York State Psychiatric Institute.
Alejandra Vargas at D.D. Hirsch Mental Health Services.
Erika?
My name is Erika Contreras, and I am the case manager at the Life is Precious program.
I'm Maria Challen. I'm the mother of a participant at Comunilife, Life is Precious program.
I'm Ray. I'm one of the participants at Life is Precious, specifically in the Bronx.
Good morning. Good morning, everyone. My name is Alma Ramirez, and I'm a participant at Life is Precious.
And before we turn it to the Secretary Becerra for his remarks, we have a short video.
Háblanos.
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 The expansion of 988 first and foremost means access to care. They can reach out to somebody to talk to whenever they need it. There's always a listening ear.
Often in the Spanish-speaking community, we can see that individuals are not sure what to do when a loved one is experiencing thoughts of suicide or is experiencing mental health issues.
Sé un apoyo.
Sé un apoyo. Crisis is different for every single person. We all have to remember, like when we're providing services to folks in crisis, is that crisis is completely self-defined. If they're saying this is a crisis, it's a crisis.
I've always had a passion for mental health, especially being someone who can help educate the Latino community. So one of the things that really attracted me to D.D. Hirsch was that there was a Spanish call program. It was something that created an opportunity to be able to educate the Latino community a bit more.
SAMHSA has been a huge proponent for 988, and they have been just amazing in making sure that the crisis centers who have been doing this work are finally getting what they need to make sure that when that telephone rings, there's somebody there to answer it.
Comparte tus pensamientos.
Comparte tus pensamientos.
When you call 988, you will hear a recording and choose your preferred language, and you will have a brief moment where you wait, and then you'll get connected to a crisis counselor.
The stigma around talking about mental health issues in Spanish-speaking communities is so strong that sometimes it's easier for Spanish speakers to call and say, I'm not calling for myself. With Spanish chat and text, what we're anticipating is that people are gonna feel more comfortable reaching out when they don't have to hear somebody's tone of voice. And so I think we'll see more openness from people.
When someone is speaking about their pain, their emotional, mental pain or circumstances, it's important for them to be able to express this in the way that they feel most comfortable. And that's what having bilingual counselors allows us to do.
Hay esperanza.
Hay esperanza.
Hay esperanza.
No estás solo.
No estás solo.
No estás solo.
And now is my honor to introduce Secretary Becerra. Thank you.
Frankie, thank you very much. And I want to first begin by saying to La Doctora Gil, thank you for immediately making me feel like I was at home, como si estuviera con familia. Y I guess that's what this is all about, right? The program Life is Precious is about making participants feel like they're in a safe space. And I am thrilled to be flanked by our Deputy Secretary, Andrea Palm, and our Assistant Secretary for SAMHSA, Dr. Miriam Delphin-Rittman, who have worked tirelessly with our big team at HHS to make it possible for us to reach out to people who are suffering, who are experiencing mental health challenges. And it is such a treat. Actually, es un orgullo poder entrar a un lugar donde uno se siente como va a recibir la ayuda de alguien que lo conoce. Even if you don't know them, you feel like you know them. And I can't tell you how important that is. And to do it in a culturally sensitive way, wow. I don't know if we're going to leave because you just have to give me some food now, and then it'll be complete. Let me just mention a couple of things, and I want to turn it over to Deputy Secretary Palm. 988 is here, and it's becoming what 911 is for emergencies. And here's the important part. Because President Biden made a commitment to it. The year before President Biden took office, the federal government, HHS, devoted about $23 million to help stand up 988. We knew that we had to do way more, because to make this a national effort, where if you called, if you got to that fork in the road and you were saying, I'm about to go the wrong direction, but I'm going to try one last time. And if you make that one last effort by calling 988, we got to make sure it works. And so President Biden did something that's very special that you don't see. Instead of putting $23 million into it, he's putting close to $1 billion to make 988 work. That's the only reason today. That's the only reason today that we can say that in the past year since the launch back on July 16th of 2022, there have been 5 million contacts that have been answered using 988. 2 million more answered than in the previous year. And that's because people are calling, which is great. But it's not so great because so many people are calling. So many people are hurting. So we know we have work to do. And now we have to build on 988, because when you take the time to call us and we're there, and by the way, we're answering 4 times faster than it was previously, we have to make sure that the follow-up services are also there. The Life is Precious programs are there. And so It is such a treat to be able to be with all of you, to hear from the participants. But a la doctora Gil, I first just say, when we walk through those doors, you knew you were going to be respected. When you walked through those doors, you knew you were essentially at home. And when you walked through those doors, you knew you were going to be in a safe place and people would listen. And that's where it starts. So we're thrilled to be here where it starts, and we're thrilled to announce that we're now going to do 988, as you heard on the video, not just in English, but in Spanish when it comes to text and chat, because we know so many of our young people. So many of our young people, I don't know why, I don't get it. I gotta speak to somebody. They prefer to text or chat. And now in English and in Spanish, and quite any language, because we'll make sure we get translation service. But now if you call, you'll get someone who actually speaks to you or texts with you or chats with you in Spanish. And that's important. So with that, let me now turn it over to Deputy Secretary Andrea Palm.
Thank you, Mr. Secretary. I am Andrea Palm. I'm the Deputy Secretary at the United States Department of Health and Human Services. Thank you, Frankie, and our hosts for having us. I would echo the Secretary's comments about how clearly safe a space this is for the folks that you serve. I am certainly anxious to hear from our panelists. I think the work we do at the federal level is best informed by the people who use our services, and those are really important reminders about how we do our work, how we think about putting people at the center of what we do, so that how they interact with the dollars we push to the local level really meet their needs. I would tell you, in echoing the Secretary's comments about the priority that this is for the Biden administration, that in the 2+ years that the Secretary and I have been partners in crime at the U.S. Department of Health and Human Services, this is the first time we have traveled together. This is the first event we have done as a pair. We usually divide and conquer, but today was such an important milestone, such an important thing to mark for us as an administration and as a team at HHS, that we could not resist coming together to spend some time with all of you. I would also just want to note that the crisis system and how 988 works together with the broader crisis system and then with the broader healthcare system are things that we are also very focused on at HHS. How we integrate behavioral health into healthcare, how there's no wrong door for the services that folks need to be healthy and well is a critical priority for us, and we're working to accomplish that goal in a variety of ways. 988 is an important part of that, as well as our CCBHC initiative, how we think about services we provide in Medicaid, what we're doing in Medicare, what we're doing at ACF to support kids and families through our human services programs. All of this has to tie together in a way that we're, again, putting people that we serve at the center of everything that we do. So again, much appreciation for you all hosting us here today, and I do look forward to hearing from our participants about how we can do this work better to serve this community. And I think, please, I'll turn it over to Dr. Delphin Rittman.
Thank you so much. And, you know, I just have to say it's been such a pleasure to be able to be here already in the short time that we've been here. So appreciated the welcome. And I just learned that I'm so lucky to be able to have both the Secretary and the Deputy Secretary here with this for this really special event. But it goes to show just the commitment, and this is such a priority across SAMHSA, across HHS, across the administration, and so really welcome and appreciate that both the Secretary and Deputy Secretary are here with us to celebrate the 1-year anniversary. I also want to just say, you know, we had the opportunity to tour the Life is Precious site and to hear about the work here, and really just want to commend the team here for the amazing work that's being done. It's wonderful to hear the way in which it is spreading actually across New York as well. I also learned that an additional site is opening up in Poughkeepsie, New York, which is my hometown. And so we've talked about my hometown and in the high school that I used to go to, because now it has been transferred over to a social service agency or building. So looking forward to sort of learning more about the amazing work that you all do here. You know, I just want to reflect a little bit about sort of 988 and the journey that we've been on, really, I would say, as a country. as a country to be able to transition the 10-digit number to the 3-digit number that we have now. It has taken multiple partners, many of whom are in the room, likely many of whom perhaps are watching. And so we just applaud the partnership. We appreciate the partnership. This has been one of those transformations that we know takes a village. It has taken a village, and the village has come together to help make that happen. And for that, I am very grateful. The Secretary mentioned that there have been over 5 million calls, texts, and chats that have come in the last year. And a big part of that, I think absolutely want to acknowledge and recognize the individuals that are picking up the calls and that are taking the calls at the call centers across the country. They are heroes here. And so I thank them for their compassion, for their commitment, for their dedication to this really important life-saving work. We know, though, that our work is, we have more work to do. We have more work to do. And so some of where we're focused in the coming year is, as Deputy Secretary Palm and the Secretary mentioned, really continuing to build out that continuum. We really need it to be the case that when an individual calls, they have someone to respond and really a safe place to go for support and help as well. And so as a team and certainly working with our partners at the state and at tribal communities and community level, that is where we're focused next, and really excited about that important work to ensure that there are multiple entryways into care for people who need it. Because ultimately it's about, again, meeting people where they're at and helping them to get connected to needed services and supports. The last thing I'll say is that, we're thrilled to be able to announce the Spanish text and chat. We know that is often a preferred mode of communication, as the Secretary mentioned, for young people. And so to be able to offer that and so that people can reach out in their preferred language, we know that makes a difference. There are studies that show being able to reach out in your preferred language or talk about a crisis in your preferred language, it helps with emotional processing. And how important is that when a person is in crisis? So again, just want to thank all of our partners, everyone who's here today celebrating with us. I'm so looking forward to hearing from our fellow panelists. And I believe I'm turning it back over to Frankie. Frankie.
So we're going to start our chat, and I'm going to move here because I want to be able to see you and be able to see our amazing audience here. And we're going to go around and ask a few questions. And let's start again back to Secretary Becerra. It's an amazing transition, right, to go to 988. And you have talked about the number of calls, but I want also to hear a little bit more. What do you feel most proud of the accomplishment of this transition and everything that you have been able to do so far?
And Frankie, I'm going to be brief because I think we all want to hear from the participants.
Yes.
But I will say this, getting rid of the stigma. I remember growing up, but you used to always, I remember, aguántate. Just, suck it up, hold it in. You can handle it. Don't go, aguántate. There are too many people, especially our young people, who están aguantando mucho. And we need them to be able to open up. And so one of the things that I believe 988 does is it gives them that first chance to open up. But it can't be the last, because it's not just over a phone line that you're going to get the solution. You need to have the care. You need places like this. And so what we're hoping is that what we can do is open the door, let people believe that we're not just ready to listen, but to actually offer services as well.
Absolutely. And Deputy Secretary and Assistant Secretary, if you want to talk a little bit more about how the line, any one of you can talk about how the line is going to be complementing the work that many of these organizations like Comunilife and Life is Precious program, how this is going to be integrated.
Yeah, thank you for that question. I think it creates a real opportunity to create an additional on-ramp or entryway into organizations like Life is Precious and Comunilife. One thing we know is that when an individual calls 988, in addition to talking through whatever challenge they're experiencing, they'll also get linked to relevant, culturally responsive, community-based services and supports to the extent that is, that's aligned with what they need at the time. So I think it creates an opportunity to form a real partnership with Life is Precious and Comunilife and other similar community organizations to really help connect people to care. And ultimately, that's what it's about, to help folks when they're struggling to get connected to the needed support that that will be helpful so that they don't experience what they're experiencing alone.
I'm very proud of what Secretary Becerra has been able to accomplish and the entire team, because from the very beginning of the onset of the pandemic, it was always about the trusted partners in community, the culturally relevant. How are we going to tackle this? And that brings us to Dr. Rosa Gil, who has been in many discussions with me for many years about this program and the amazing work that is being done, but also in a city like New York that is so ethnically and culturally so diverse, how is important is to recognize the differences in our communities that are important to our pride, but at the same time, there are some challenges. So Dr. Rosa Gil and also Dr. Luis Fernandez, if you want to talk a little bit briefly about how do you tackle these challenges, taking into consideration the pride and the diversity of our community, but at the same time being very effective in the work that you do. And you have been doing this masterfully for so long.
Thank you, Frankie, and thank you. Thank you, Secretary Becerra and Deputy Secretary Pam and Assistant Secretary for being here. Bienvenido. Welcome to our house again. You know, the lack of, when I think about barriers, for access to care for the Latino community, I have to think about the fact that we do not have enough bilingual, bicultural mental health providers to meet the cultural, social, and language needs to the Latino community in New York City and New York State. Particularly, I want to say, a great core belief that we have is children grow up in a family. And if children develop challenges emotionally, the family must be involved as part of that treatment equation. Mm-hmm. Regretfully, in New York City and New York State, 99% of all the treatment intervention is individual psychotherapy. It's a hell of a thing for us at Life is Precious to access family therapies, and we have to seek philanthropy to be able to help us to get the Ackerman Family Institute and other family practitioners who are Latinos here in New York City. So that's one barrier that needs to be addressed too. Also, there are currently no identified suicide prevention strategies listed in SAMHSA Best Practice Registry or the Suicide Prevention Resource Center to address the unique, and I underscore, unique challenge faced by Latina adolescents and suicide behaviors. The gap in evidence-based practice compromises the quality of mental health services for our communities and highlight another thing, which is the research inequalities underscore in addressing the mental health need of Latina teens and the Latino community at large. Without that research data, it is not for us helpful because we don't have the best practices. The mental health delivery system, as I know for over 50 years, does not support community-defined interventions that are delivered within the specific and intentional way that we know that it works in our community. The mental health the delivery system does not support community-defined interventions, and basically the treatment that should be the core to be able to reach the patients that reach out to us all in this field of the practice. However, in Comunilife, when we see a gap, we try to do something about it. So in the absence of any evidence-based practice to address the suicide behavior among Latin adolescents, 15 years ago, I was crazy enough, quote, to create Comunilife, Life is Precious, a community-defined based intervention without no funding. And that's why you see so much white hair now. Life is Precious. We have served more than 600 adolescents during these 15 years. not one have completed suicide. Comunilife goal is for Life is Precious to become an evidence-based practice and help SANSA close that gap. This is why we have been working with Dr. Roberto Luis Fernandez and New York State Psychiatric Institute, Columbia University, for over 10 years to build up this evidence-based practice. Throughout these 15 years, Comunilife has not been eligible to receive funding for Life is Precious as a community-defined intervention from the federal government or from New York State because, quote, we are not an evidence-based practice. How do you like that catch-22, right? But that doesn't stop us from doing something about it, and I do encourage all my colleagues here. Barriers are to be surpassed, despite the institutional barrier. So here we are, and we just would like a little bit of funding to be able to continue to do, just a little bit more funding to be able for the researchers.
Let me write that one down.
To be able then to have an evidence-based practice that is used throughout the United States. Today, we're talking to Puerto Rico about using this model. North Carolina is reaching out, Texas, Arizona. But we want this to really become an evidence-based practice.
Very good. Dr. Lewis.
Thank you very much. Great to be here. I want to emphasize the fact that Rosa has been doing this and her team with very little support. They've been really drumming up all this work and have received grants from different agencies. And our center is funded by state funds, and we've also assigned some funding to researchers to participate. But the research runs on grant money, and so they've been very successful. Elise and others have worked very hard with Rosa. So I just wanted to underline that. We have been working together since at least 2010, 2011, something like that. We started our projects together in 2011. And I first want to say just how important it is that this, in terms of the cultural competence element, that this program, Life is Precious, is actually practice-based evidence. It's not evidence-based practice in some ways. It starts from the community and it builds evidence from it. And they've developed that both in process and in content of the program. They processually, they have involved the community, the youth and their mothers in creating the program. They did focus groups back then, 2008 or something like that, in order to start the program. And then they've been building out it ever since. And the content of the program is also based on those conversations and that data from the input in order to know what elements to create. They reached out to us so that we could provide some of this help in creating the evidence and obtaining the evidence to determine its role as a practice-based evidence, evidence-based practice. And that has gone through several phases. The first phase involved a mix of tracking, following the youth, the young women, for a period of time. The longest we followed was about 2 years. A given person, and we assess them, they assess them every 4 months. We then ran the data and found that there was a steady, statistically significant decrease in suicidality symptoms, in depression, in trauma-related symptoms in these young women as they participated in the program. That was one level of evidence. It's this sort of quantitative follow-up, which followed all the rules, if you will, for being significant. And then there was a second step, which involved qualitative work, focus groups, interviews with the participants, with their mothers. That was the second part of that first phase that ended in 2017. That also showed that the participants we'll hear from them in a minute, considered the program to be a safe haven. They learned a lot of coping skills. There was a lot of information that was provided there. That led us to do a second phase, starting in 2018 or so. It's ongoing, finishing up now, where we did a comparison of the girls who were in Life is Precious and also receiving mental health treatment and versus girls who were in the same parts of the city but were receiving mental health treatment without Life is Precious. We have that article. It's in a revise and resubmit, meaning it's almost accepted for publication. And what we found was a strong signal for Life is Precious having an effect. For example, when it comes to reduction in suicidal ideation, there are a couple thresholds for a 25% decrease or a 50% decrease in a scale. In the 50% decrease, cutting in half the symptoms of suicidal ideation, Life is Precious was 3 times more effective than the control with respect to that, and in reducing depressive symptoms, twice as effective.
Excellent.
So there's a lot of evidence in favor of Life is Precious. The next steps would involve, for one thing, understanding the impact of COVID, which was actually had a strong impact on the lives of the girls, especially the school closures and the being stuck at home. And then, apart from that, in addition to that, would be expanding that initial assessment to do a larger study so that we can find with more rigor, more robust findings about these, because it was necessarily a smaller study, expanding that study and making it, training other programs and seeing how that training works in order to see its effect more widely.
Excellent. Excellent. Thank you so much, Doctor. This is amazing. I'm going to move very quickly to Alejandra Vargas. You have been working with the 988 line and the inclusion of the Spanish text and chat services. How do you think, in your experience, that this is going to impact the crisis support in communities and especially large-speaking populations, Spanish-speaking?
Muchas gracias por esa pregunta. Primeramente, exactamente todo lo que se ha dicho ya en esta mesa es la situación de la prevención del suicidio es de base comunitaria. No, se comienza en lo individuo, pero también fomenta en la familia, en la comunidad. Entonces, la oportunidad de tener y proveer los servicios de chat y texto bilingües en inglés y en español nos ayuda a conectarnos con la comunidad a un nivel que no existía anteriormente. Es increíblemente necesario para las personas latinas, hispanohablantes específicamente, en todo el país. Y hemos visto ya un incremento en los individuos que buscan nuestros servicios. Thank you so much for that question. I'll translate as well. Being able to provide this service bilingually in English and Spanish, it speaks to everything that's already been said at this table. It's individual, it's family, it's community-based services. This is an additional layer to that, and together we can work as a community to address this really huge problem within the Latino and Spanish-speaking communities. And something that I forgot to mention earlier is that yes, there's this reduction of stigma within the Spanish-speaking communities, but also it's so natural for us as Latino community members to already do this, el desahogo. We already unburden ourselves, but in very controlled spaces. This is expanding our ability to desahogarnos, to unburden ourselves in ways that might feel more safe, more culturally competent, more appropriate for our demographics, for our age, where we live, the kind of family system that we live in. Y en español ahora también, porque se me olvidó decir esa parte importante. Una de las otras maneras que este servicio realmente nos ayudará es de que ya como latinos sabemos cómo cuidarnos, el desahogo. Es algo completamente natural para muchos de nosotros en nuestra comunidad. Y tener la oportunidad de hacer esto mediante chat y texto nos da otra oportunidad de desahogarnos de manera natural, que nos afecta en lo personal, dependiendo de con la confidencialidad, quién vive en nuestro hogar. Es simplemente otra opción. Thank you. Gracias.
Qué bonito ser bilingüe, ¿eh? Thank you so much. I want to go to Erica now. Erica, from your perspective as a case manager, you work with cultural relevancy, but New York City and everything that is happening, fast-paced, ever-changing, reality for our youth, that poses kind of like a challenge for cultural relevancy and being able to provide these services, especially in programs like Life is Precious. What is your perspective as case manager?
Thank you so much for your question and this opportunity. I first want to start sharing that psychology today defines familismo as the central Latino cultural value. It involves dedication, commitment, and loyalty to family. Comunilife integrates familismo into all aspects of the Life is Precious program. Latina teens often experience a struggle between their need for autonomy and independence prevalent in the American society, which is different from the traditional Latino culture. This conflict can increase risk factors and lead to suicidal behaviors when Latinas feel pressure to show family-oriented behaviors. Life is Precious staff act as cultural brokers, having the ability to understand and navigate the unique circumstances and cultural backgrounds of Latino youth growing up in New York City. We help clients understand their parents' culture and vice versa, fostering positive communication and understanding. Comunilife Multicultural Relational Approach Assessment Tool incorporates the relevant cultural content into assessment and treatment plans. This tool aids in determining Latina teens and their families' mental illness within the cultural background. These assessments help us gain valuable insight to their cultural values, beliefs, and expectations, enabling us to provide services to meet their individual and collective needs. Life is Precious also offers bilingual workshops and parent support groups, such as de-stigmatizing mental health, understanding adolescent mental health issues, and also intergenerational trauma, to educate and support parents. These workshops address relevant topics while taking into account the cultural context and values of the Latino community. By incorporating these strategies, we provide culturally relevant services to LIP teens while being sensitive to the unique cultural backgrounds and the social dynamics of New York City. Thank you so much.
Thank you so much. And now, with all due respect to Secretary Becerra, we're going to go to the stars of this conversation. the real reason why we're here, and we're going to hear from two amazing young women, Latinas, that are part of first account of how important Life is Precious program is. So, Rae and Alma, I want to ask you, and first of all, thank you for being part of this conversation and wanting to share your experience. How are your lives different from before you joined Life is Precious? And also, what part of the program helped you the most? And what are the biggest challenges you see for Latinas like yourself?
Do you want to go first? Yeah. Hi, good morning. Right now, I'm an upcoming junior at Brooklyn College. LIP third year, I guess. LIP helped me emotionally and academically to reach my goals, such as my academic goals, I'm sorry. LIP helped me apply to college and with touring so I could be an outstanding student at the high school that I was attending to. The part of the program that helped me the most was getting out of isolation. As Hispanics, every time that we feel depressed or we feel anxious, we are told that, Mr. Becerra said, to suck it up, right? Aguántate o ponte las pilas o todo va a estar bien. And you're just like, what pilas? Where are they? Where can I find them? Right. I'm running out of batteries, I guess. But when I was going through depression, I isolated myself. I'm the only child, so being without my parents was really, really hard. But LIP helped me and gave me a home, something that I didn't have at my house, because having a house and having a home are two different things. But the organization helped me deal with my anxiety with the art and music therapy and that the girls and I were having at LIP. One of the ways that helped me cope was writing poetry. I write poetry, but I only write poetry in English. not in Spanish, even though Spanish is my first language. And I think it comes back to being able to express in English and not in Spanish, because in Spanish, we're not really open to our feelings and we're not really open to our mental issues. The biggest change that I see now in myself is that I'm more future-oriented. I see past the dark times that life sometimes puts me in, and now I have goals that don't seem too hard to reach. Thank you.
So, similar to Emma, I joined during the peak of COVID, and this was when everyone was inside. And before even COVID existed, I already had a lot of mental issues, so this added on to it. I was very different before this program. I was younger, I had longer hair, but I was also very self-isolated, and I did not want help from anybody. So walking through those doors, similar to a lot of the girls here, it was a very different experience. You don't know what to expect when you come here, especially when I did, because you're online. You didn't get to see anyone, you didn't get to interact. But once you start to, you get to see so much of why LIP is basically a second home to a lot of the girls here. There are a lot of pieces that go into the puzzle of LIP. For example, you have art therapy and music therapy, most recently drama therapy. But personally, I believe that what makes LIP is the community that you have here. You have the participants that come here. You have Chastity, one of our caseworkers. And it just makes coming here feel so special. And there are so many other things to add on to it. Like just recently, we have our peer council. And that is pretty much similar to a student government, except not really. But you know, it helps everyone get represented, and you can see yourself in not only the girls here, but you can just see yourself in you, which a lot of girls can't do that. And so finally getting to see yourself in those things. And I had a very hard issue with being able to look at myself. So now that I am up here telling my story to all of you is very grateful.
The eloquence, the intelligence, the presence, there is a bright future for both of you. Thank you so much for sharing this gift. But one element that Dr. Rosa Hill mentioned at the beginning was the family integration. How important this is for our community. And we have now the testimony of a mother. Maria, I want to ask you, what was the situation that you were going through with your daughter, if you can share that with us, before joining your daughter and you, Life is Precious, and, how the program really helped you, your daughter, and your family?
Thank you. My name is Maria. I'm a Latina from Ecuador. My daughter has been with Life is Precious since 2019. Prior to LIP, my daughter struggled with depression. She was unmotivated, and it was a challenge for her to function and socialize with her peers. As a mother, this period was incredibly difficult for me. Fortunately, LIP has provided invaluable support for both my daughter and me. Before finding LIP, there was nowhere for her to connect with peers in a safe environment. This was a place where she could go after school every day if she chose, and she was at ease while also receiving professional guidance. What made LIP particularly significant to me is that there is no place like this, and there was nowhere for Latina teens to go. Many mothers who don't speak English have limited options when it comes to seeking help for their children. We discovered LIP through a referral from an insurance social worker, and it has been a game changer. The resources we had once were no longer available, but LIP stepped in and provided us with an educational and secure environment. LIP provided us with family art therapy and psychoeducational workshops, where at times staff and other times psychiatrists discussed topics such as mental health and diagnosis, medication, and safety planning for our daughters. This helped us get rid of the misinformation and allowed us to engage in more direct and informed conversations with our daughters. Additionally, we had the opportunity to learn about COVID-19 precautions from a doctor. These support groups created a sense of community among families like ours who understand the struggles of having a daughter who was suffering from depression. In the Latino community, there is often a stigma when it comes to seeking mental health, as we've all discussed. At LIP, they normalized having these conversations and helped us lose the shame. I felt accepted and connected with other moms, mi gente. Our shared values and culture brought us together, fostering a sense of unity. LIP and the conversations with other moms have helped me perceive mental health from a different perspective. Being part of LIP provided me with a deep sense of community. El apoyo de LIP me dio nuevas ideas. Gracias.
Muchísimas gracias. Muchas gracias. Thank you so much for that perspective, and so important as the element of family and family integration into all of this. It will be really difficult for anybody to do this if you are living with a family that would not believe in this. And thank you, Dr. Rosa Gil, for just integrating, making sure that this is part of it. So now, after this very rich and insightful discussion, I'll toss it back to Secretary Becerra.
And I want to make sure I know from my team how much time we have left, because I know some. Oh my gosh, 6 minutes.
6 minutes. Oh, 6 minutes.
And do we have any press, or do we not?
Yes,
So we're moving to see if press has any questions after we make a few comments. So we have 6 minutes to close, and then we do press. Okay. Okay. So there's no. What do we need to say? They said it all. They said it all really well. I hope that I know that Dr. Heath's not going to let go, and so you got the three of us here. She's going to corral us for a little bit of that dinerito that she was looking for, and you know what? Go hard, push. It's con ganas, as we say in Espanol, right? Con ganas, sin dejar. We need to do this because look, you have stars. They're just waiting They're just waiting to come out of their shell, and I hope that we can help at the federal level through Dr. Delphin Rittman and her team at SAMHSA, through the 988 program. I think Assistant Secretary Palm and I are just hoping that you will push, that you will push hard, because if we have resources, this is where they should go. Because this is the future of this country, and we need to discover that future sooner than later. That rainbow is pointing right at them, and we can get there. And we are thrilled that at the Department of Health and Human Services estamos poniendo nuestro granito de arena para ayudar, that we're helping a little bit, and that perhaps with the 988 program, and now making sure that it has living color, it's got stereo because we do it more than just in English, that we're helping people believe that America wants to listen and America wants to help, because there is no, especially young person in America, who shouldn't feel like they can just show us all their talents and all their gifts. And so that's what this is about. Doctora Gil, Frankie, to Comunilife, and to the Life is Precious program, but mostly to the participants. Thank you for letting us be here. Let me ask Assistant Secretary Palm and Deputy Secretary Palm and Assistant Secretary Delphin Rittman to say a few words before we have to close and do the press conference.
Thank you, Secretary. I would just echo the thanks to our hosts. 600 women owe you a lot, and we owe you a lot. So, and to you all. It always strikes me when I'm in these settings how much bravery and self-possession it takes to tell these stories, and so we need you to keep telling them, to remind us why we do what we do and how we are responsible for being helpful in the success of the American people. I started my career as a crisis counselor, so in some ways it is quite remarkable to see how far we have come, and sadly remarkable to see how far we still have to go. Marking the 1-year anniversary of the transition to 988, understanding the ways in which we have expanded capacity, reduced wait times, and increased our response rates. Now adding Spanish text and chat, again, another really important milestone as we think about how we drive to complete the work that we need to do and how we make sure that there is no wrong door for folks who need mental health, substance use disorder, who are in other types of crises and who need us to meet them where they are. And so again, I'm just really grateful to have a chance to be here today, to be reminded where I started and why it is that I continue to want to do this work and who I'm responsible to getting it done. So again, my appreciation to all of you. It's a real privilege to be here.
Yeah, thank you. And so, I just would like to echo a lot of that as well. I mean, thank you so much to the young women that shared your stories and your experiences and even the work that you do here. It's so helpful for us to be able to hear and hear your experiences. It helps to inform our thinking as we're thinking about our work and know that you've planted really important seeds, and so certainly seeds that we'll be sort of working on and thinking about as we go back in terms of how we work to ensure that services and supports are meeting the needs of Latino young women, as well as others. So certainly know that we heard that message. And I agree. It's just such a gift to be here, to be able to have this conversation. I would be remiss. I just want to acknowledge, we do have a few members from the 988 team here. Just want to acknowledge, the director of our 988 Crisis Counseling Coordinating Office, Monica Johnson, and we also have members of the Vibrant team as well as other members of the 988 office. And so just, they're in the zone, and just so appreciate the the partnership really with many of you and folks really across the country. So I did want to say that. And thank you for just having us here today and welcoming us. And I know this will not be our last conversation. I look forward to more conversations, particularly hearing about some of your data, because I think that will really help to inform some of our work. So thank you.
And with that, we close this part of the program. We have a couple of minutes to reset, and we will continue with the press conference. Thank you, everyone.
Thank you.
been doing and the team, but also for being here today to make an important announcement about the 988 line and the impact that this is going to have on culturally competent, linguistically competent services for mental health, especially in our community. And with that, very quickly, I'm going to introduce Secretary Becerra. Thank you so much for being here. Thank you.
Frankie, thank you very much. And what a great session we just had here at Comunilife, where we heard from participants in Life is Precious, a program that helps young women, young Latinas, have an opportunity to really open up and be themselves and succeed. And so it is a thrill to be here. I am joined by Assistant Secretary Miriam Delphin-Rittman, who runs our SAMHSA program, which operates all our mental health and substance use services, and by Deputy Secretary Andrea Palm, who helps, along with me, helps us run the entire operations of the Department of Health and Human Services. I want to say, where did Dr. Gil go? Here she is. Get over here. Véngase. You're too far away. I want you right here. Yeah. Aunque no la pueden ver, pero I want. I just want to say that it is people like La Doctora Gil who really make the doors open when everyone thinks that life is closed, and so much so that they're willing to take their own life to prove it. And every once in a while, someone like Rosa will step up and say, no, we're going to change that. We're going to change that. And we're very fortunate when we can stand by someone like Dr. Gil, ¿cómo lo dice?
No, Gil.
Okay, Gil. La Doctora Gil. And we're very fortunate when we can stand next to someone like Dr. Gil, who has really changed lives. And what we're hoping we can do at the federal level, at HHS, is work with dynamos like La Doctora Gil to open those doors. And 988 is life-changing. Mm-hmm. It was a true game changer when it came to mental health and substance use services, because we, for the first time in our country's history, said nationally, we hear you and believe us when we say we want to be there. And 988 is becoming what 911 is for emergencies, but in this case for folks who are experiencing mental health or substance use challenges. We want 988 to reach everyone. We want everyone to know that if they call, text, or chat to 988, they will reach someone who will listen and who will care. And today we're very proud to be able to announce that not only can you reach someone who will speak to you by phone, text, or chat in English, but as of today, you can reach someone by phone, text, or chat in Spanish as well. And for that we are all very proud, and we have people like Dr. Gil to thank for that. And so the message to you is, like the other 5 million Americans who in the last year reached out and were contacted, they actually reached someone who was trying to help them. We want to say to you, don't go in the wrong fork in that road. Call us, text us, chat with us, 988. We are going to be there for you. If you do try to reach out to us, 988 en español, o 988 lineadevida.org. We'll be there. We'll talk. Estaremos allí. Hablaremos. Ayudamos. Queremos verlos crecer. Queremos verlos vivir. We want to help you be there and to live and to grow, to thrive. And so it is with an immense pride that we are here at Comunilife to make the announcement that not only has 988 had tremendous success over the past year of its launch, but today we announce that we're going to make it even more successful because we'll reach more people in their language, in their culturally appropriate ways in Spanish. And for that, this son of immigrants is extremely proud. And with that, let me now turn it over to the Deputy Secretary of the Department of Health and Human Services, Andrea Palm, excuse me. Andrea, I'm sorry.
Appreciation again for having us here today. In addition to what the Secretary said, I would just connect 988 and the progress we've made and the announcement today to the broader work of the department as it relates to mental health and substance use disorders. This is a door in, and the work that we do more broadly needs to bring the remaining suite of services and expertise and programs that we have to wrap around folks who have the courage to pick up the phone and call 988, to text or to chat with us, so that we are not only meeting people where they are in that moment of crisis, but so that we are building a network and the capacity for those folks to be handed off to the kinds of services and supports they need longer term, again, so that we are promoting the health and well-being of this entire nation. And so with that, considering the time, I think Dr. Delphin Rittman, I will pass it to you.
Thank you so much. And, I just have to say, it's just been such a pleasure to be able to be here at Comunilife. The welcome has just been wonderful. It's been wonderful to hear about just the range of programs and the ways in which they're working directly with folks and really meeting folks where they're at, young women and others, to help them advance in their recovery and experience wellness. It's also just a pleasure to be here today just to announce and to celebrate the 1-year anniversary of the 988 Suicide Crisis Lifeline. This has been a partnership with so many partners across the country. And so, we often say we could not have done this alone. And so in many ways, we're celebrating today with many of our partners at the state level, at the local level, tribal communities, and it truly has been, a work in progress among just many partners across the country. One thing that we're really pleased about is, we know that 988 is reaching folks, that people are reaching out to get connected to support. The Secretary mentioned about 5 million people reached out across calls, texts, and chats. And so it's heartening. To me, it's heartening to know that people see this as a resource, and they know and understand that we're here. When people call or text or chat 988, they'll be met with a compassionate counselor who is there to listen and to help them with whatever they're experiencing. But we know there's more work to be done, and so just to share a little bit about some of our vision moving forward. What we're working on now is just continuing to build out the full crisis care continuum, continue to build out the range of services and supports that certainly I'm grateful that the Biden-Harris administration has invested in. But we're looking to stand up things like, expanding mobile crisis teams, thinking about stabilization centers, as well as other services and supports at the community level so people can get connected and really begin or continue their recovery journey. So again, just thrilled to be able to partner with the many folks that we partner with. Thank everybody for the work that we're doing. I often say that the individuals at the call centers that are answering the calls day in and day out, 24 hours a day, they're true heroes here. And so would be remiss if I did not thank them for their just compassion and their commitment and dedication to this work, both the call centers as well as receiving the texts and chats. And so did want to just mention that as well. But again, thank you everyone who is celebrating this 1-year milestone with us today, and happy to continue the partnerships and really looking forward to that. So thank you.
We have time for a few questions, so name and source.
Ron Allen from NBC News. As you think about this broadly, the anniversary, what do you think, in a broad sense, I know we're about the specific announcement, what do you think in a broad sense the nation has accomplished by getting to this 988 number? And secondly, I've seen polls that suggest only 13% of the public knows about this at all. How do you change that?
So I think the message here is that we're breaking down stigma. We're letting people know they can reach out. For too many people, and as we heard, some folks don't know where they can go, don't think they have any place to go. 988, it doesn't take much to be able to reach 988 now. Call, text, chat. And it's working. And that's the beautiful thing is I can stand here and say to you after a year, it's working. How many times have we not been able to say that about projects or programs that we thought would be great successes? So now we have to build the understanding of 988. If you ask that same population that you polled, or that was polled and said they only about 11% know about 988, ask them about 911, they'd probably say, yeah, of course I know what 911 is. We have work to do. We want folks to understand that 988 is 911 if you're having mental health or substance use challenges. We'll get there because it's working and people want to know about the good things. And so we'll get there. I hope sooner than later, but with the help of great organizations and young people as well, getting out there and talking to their peers, we'll get there.
Las latinas tienen un alto índice de suicidarse, como bien la doctora Gil lo ha dicho y lo hemos visto pues por medio del programa de Life is Pressure. Agregar este sistema, este servicio en nuestro idioma, ¿cómo lo hace sentir a usted? Como dijo, poner ese poquito de arena.
El respeto cuenta por tanto. Si uno no se siente respetado, se va, no participa. Si uno se siente respetado, abre la puerta al alma. Y abriendo esa puerta al alma, todo es posible. Y por eso es tan importante poder abrir esa puerta al alma en español. Porque diciéndolo en inglés, solo están tocando. Quién sabe si contestan. Pero decirle, oiga, por favor, déjame entrar. Quiero ayudarle. Se abre la puerta.
Well, that's all the time that we have. The Bruckner is really, really bad right now. So we need to go to his next appointment. Thank you so much, and thank you to the
Thank
Secretary
you all
and the
very much.
Federation. Thank you so much.
Que Dios lo bendiga. Gracias.
Se pone en contacto con la